if she's coming. We're going to go ahead and get started. Again, thank y'all for coming, especially to my fire brothers and to the cops that showed up. Thank y'all. This morning, we already did the housekeeping with the bathrooms and everything. This morning, we're going to have some presenters. I know that we're in a negotiation, but this is way too big of a project for us to have any negotiation, I guess, going on today. But we're going to have quite a few presenters, and I'm just going to give you a short bio on the speaker that's coming up, and then they're going to introduce the next one. And we do have them, so if y'all want to read about who they are, I have packets, and I'll hand them out when I come down. Our first presenter today is going to be Bob Sugarman of Sugarman Suskin out of South Florida. Bob has many years of experience in the trust, in trust, of course, as being an attorney. 35 years experience working in the public sector, in retirement system, VIVAs, and health trust. For the last 25 years, he's been listed as one of the best lawyers in America. He again enlisted in Florida Trend Magazine as among Florida's legal elite and is chosen as a super lawyer. To that end, there's a lot of stuff here. Bob Sugarman is going to come up and do a presentation for you, and he'll introduce the next person, and I'll give out these things. Long and distinguished body. Thanks, Bob.
Good morning. Can you all hear me? Yes. Is it working? No. Councilmen, officers, firefighters, officials of the city, and interested friends. Thank you for giving up your time today to hear about the best way to provide health insurance benefits to police officers and firefighters. I've been involved in well, I'm a labor lawyer, labor and employee benefits lawyer. My job is to help people secure their futures and keep their families secure. What I can tell you is, having negotiated all sorts of different ways of providing health insurance, that health trusts are the best way to provide health insurance to firefighters, police officers, and their families. The reason for that is because the health trusts offer three things. They offer accountability, they offer transparency, and they offer self-determination. Now, this is not some new idea. This isn't something that we're bringing to Tampa to try out for the first time. This is something that we've been doing for 35 years. Most of the health trusts that you see listed in the handout today, we helped set up. And they have an unbroken record of success. Success meaning satisfied members, satisfied families, satisfied cities, and financial stability. This is the way we deliver health insurance benefits to firefighters and police officers. So let me go over those three advantages. First of all, the advantage of accountability. There will be a health trust set up, which will have a board of trustees. We're going to tell you more about that. The board of trustees are union officers, directly elected by the members of the union who will be the recipients of the insurance. If something goes wrong, if they're not happy, the members, with how their insurance is being provided, they can solve that by voting out the people as their union officers. They know who their union officers are. They meet with them monthly or whenever the union meetings are provided. They know their phone numbers. They know where the union office is. There's direct accountability. The members elect the people who run their health trust. Secondly, transparency. The Board of Trustees probably for the first year or two will be meeting every month, every other month, as we get used to getting things up and running. Those meetings are open to the public. They're advertised to the members. They want to see what's going on. They want to see where the money's going. City officials want to see where the money's being spent, how it's being invested. Come to our meetings. The investment managers will be there telling you where the money is invested, how it's being invested. You want to know how much our claims are? Our administrator will be there telling you, everybody who can come to this public meeting, to learn exactly what's going on. A member is unhappy with the claims are taking too long to be decided. Somebody wasn't polite to them on the phone. Can this person be included on our panel of providers if we have such a panel? They can come to the meetings and talk to people they know, their fellow police officers, their fellow firefighters, about their insurance, their needs, to people who are covered by exactly the same plan, do the same kind of work, and have been where they are. It's local control, but it's transparent, because everybody's there. And of course, the main thing is self-determination. The firefighters and the police officer unions will no longer be bargaining benefits with the city. The city will not have to guess, what do these members want, what kind of panel do they want, should there be a higher benefit here, a lower benefit in this type of classification, what's the utilization. The city will give the health trust the money that's negotiated in the collective bargaining agreement, and the health trust will make all of those decisions. So if the members, a group say, you know, we need more of this kind of a benefit, or the trustees say, no, we're not using this benefit, maybe we can put it somewhere else. That can be done by the trustees on the run, not just at open enrollment, not just at the end of a contract. They can meet the needs of the firefighters and the police officers and their families as those needs arise. One time I was sitting at a trust meeting and someone came in and said, my child was an infant. My child cannot breastfeed. My child cannot consume off-the-shelf formula. The cost for the formula for my child, I remember this all these years later, is $35 a day, a couple $100 a week, because it's a prescription formula. It's due to solve a medical condition. But it wasn't covered by the express terms of the plan, because the board had never encountered that before. The insurance company would deny it and say, it's food, we don't pay for food. This wasn't food. This was something necessary to keep the child alive. We amended the plan, knowing we're going to get one of these every 10 years or so. It's a very unusual benefit. That child was able to be fed. The member was able to feed his child without spending half of a week's paycheck back then to feed an infant baby. Those are the kinds of things that we can do. We're not giving away money. It's not the trustees say, oh, well, yeah, you feel better with a tummy tuck, so we're going to pay for that. No, they have their own advisors and their own responsibility. But when there's a real, unique, one-of-a-kind need that we, as firefighters and police officers, need to take care of our families and our friends, they're able to do it. And the people that they come to, you don't have to make an appointment to see somebody. You don't have to call some faceless person on the telephone. You go down, say, hey, Joe, this is the problem I got. And they'll say, come on down to the trust meeting. Let's see what the trustees can decide. That's the advantage of self-determination. The benefits are decided by firefighters and police officers, as are claims appeals. Now, the key to all of this, so how does this work? Is it really too good to be true? No. Anything that's worth having takes a lot of work. You'll see the product of some of that work today. But the key to doing this are two things. One is committed trustees. We have to have trustees who are not saying, I want to be a union officer because it's kind of cool to be Mr. President, and we call Mr. President, I can go to some conventions. No, no, no. When you take on the trustee job, you take on the highest duty known in the law. You are a fiduciary. You have to put the interests of your participants and beneficiaries above your own self-interest and above the interests of the union. So, when you take on a union presidency job, it's a big, or a union officer, it's a big responsibility. You have to look out for the whole group. When you take on a trustee job, that legal liability is amped up to the highest liability known under law, the liability of a fiduciary, to look out not for yourself, not for the union, but for the exclusive benefit of the participants and beneficiaries of the fund. The police officers, firefighters, and their families. It now adds a level of responsibility to the union officers that they haven't known before. But remember, nobody forces you to be a union officer. People run for the job, often run against each other. So we know that the people we are going to have as trustees, because they're volunteers, run for this job, and by the way, don't get paid for being a trustee, are going to be committed and passionate to this task. The second thing that we know is that the key to success is hiring experienced and trusted advisors. The folks you're going to hear from today, Rob Fitzpatrick, the consultants firm, and Pedro Herrera, my law partner, and I, in this room now, we have over 110 years of experience in running these kinds of funds and advising them. I've been involved in this for 35 years, and I'm telling you that because of the hard work of we just set up the legal structure. Right? We're just lawyers. We set up the legal structure, we give them the best legal advice we can. But what I can tell you is that as a result of the hard work of the trustees, the satisfaction of the members who keep ratifying contracts that provide for this health trust, not wanting to seek their insurance elsewhere, and because of the committed professionals that we have an unbroken record of success. By success, I mean the health trusts have grown. They've provided more and more services and benefits and coverage to their members. We've had enormous satisfaction from the members and their families. And we've had cities who are willing to continue to contribute to this health trust because they know that we will take care of our own members, meaning we, the trustees. We'll take care of them, just give us the resources that we need to do it. So today, you're going to see and hear from people who have contributed to that kind of success and can bring that success here to Tampa. My partner, Pedro Herrera, is going to explain to you the legal structure, which I'll describe in a moment, and then Rob Fitzpatrick and folks from his office who have set up firefighter and police officer health trusts around the country will go into the details. Where's the money come from? How are we going to spend it? How can we do it? How can we afford this? How does it work? What's the real dollars? There's 3 documents that set this up. One is the collective bargaining agreement. The collective bargaining agreement will say essentially 2 things. One is our health trust will take care of the health care needs of our members. And number 2, this is the amount of money that will be given to the health trust rather than giving it to an insurance company or rather than giving it to the city's self-insured program, will be given to us at the health trust, not the union, the health trust, to take over this responsibility. So the collective bargaining agreement provides the funding to the health trust and takes the city off the hook for health insurance. Their only obligation is to give us the money that's bargained for. They write the check, they are off the hook. Our members, their families, and the union will not be looking to the city for anything more in the health insurance business. You just give us the funding, we can take care of the rest. The second thing will be the trust document that Pedro is going to describe to you. Technically, it's called an agreement and declaration of trust. The health trust will be a separate legal entity. It is not a committee of the unions. It is not part of the unions. Its money is totally separate from the unions, has its own tax ID number, has its own accountants, has its own lawyers, has its own insurance, has its own meetings. It's a separate legal entity which will exist for the purpose of receiving the money and paying out the benefits, and of course determining the benefits in the middle. So just like the city's pension fund, who we've been privileged to serve as special counsel on some cases, is a separate entity from the city, but funded from the city, so is the health trust, a separate entity from the city and a separate entity from the unions that will exist to provide this health insurance. And then the third thing will be the plan of benefits that will be determined by the trustees of the health trust based on what we can afford from the money that's negotiated and what our members want, the feedback that they give to their elected union officials. That's the legal structure. and we're going to explain that now in more detail. So, any questions on what I've explained? This is the overview. This is the flyover of what it looks like. We're now going to come down to the ground level. Any questions so far on what I've talked about? If not, let me introduce to you my partner, Pedro Herrera. We've worked together now for over 15 years. He is now the guy who sets up, advises, and helps run these health trusts. Of course, he helps me, I help him, because we're in this together. Please be kind to Pedro, his beloved Hurricanes, who he used to play for when he was at the University of Miami. Had a rather disappointing Saturday night, but I think he's able to work through that disappointment, and he's going to explain to you where we go from here.
Thank you so much, and we're not going to have to refer back to that Saturday. It's okay. I think everybody saw it. Thank you, everybody. Good morning. Again, Pedro Herrera, for the record. We're a partner with Sugarman and Suscon. And as Bob explained to you, really the goal here, the purpose here, is to not only obviously provide information, but I think ultimately the goal here is to express exactly, and as you can see by the crowd here, is express exactly how much this health trust means to your police officers and your firefighters. This is something that has been worked on now for working on 18 months. Both unions have put a lot of time and a lot of resources into hopefully what you will see here today as a thorough, comprehensive, tested model that is ready to go, ready to be employed as soon as we are able to agree on the terms. And as Bob had mentioned, I did want to thank not only obviously our members who are here,